Tell me when you got it rolling.
Started.
Okay, so today we're going to be doing a procedure on this ingrown toenail. Can we go up on the bed just a little bit? That's good. So you can see ingrown toenails for a variety of reasons. Sometimes it can be due to a malformation of the nail bed. Sometimes it can be due to inappropriate cutting of the nails, ill-fitting shoes or socks. Sometimes trauma to the nail bed can cause it. But when it happens, the nails pierce through a shallow layer of epidermal cells, which are skin cells, directly underneath the nail edge. This creates irritation along the nail edge, which is what you see here with all this redness and drainage. That irritation can actually thin the epidermal or the skin layer even further, causing the nail to actually pierce the skin edge, creating further infection. Sometimes can develop what we call a granuloma. So there you can see one of the nail edges are out. There's some different ways you can treat ingrown toenails. There are some home remedies you can use. I do caution you on these. If things aren't getting better while you're trying the home remedies, you might want to see a physician about it and see if you can get them taken care of. One of the ways we treat them is with what's called a nail avulsion. That's where we simply just remove those nail edges. If we were doing a nail avulsion today, Roger, we would stop at this point, and that would be all we would do. Roger, small Roger. However, one of the best ways to take care of an ingrown toenail is by doing a permanent procedure called a matrixectomy. And that's a permanent procedure where we don't see the nail edges come back and you don't continue to have a problem with it. Just a small. Quinn, if you can get the video down here, you can see here where actually the nail edge was pierced by the nail. And that's what was creating all the infection. If we look here on this side, you don't see that piercing as much. Mostly just some slight irritation along the nail edge. Small Roger. So since we are doing a matrixectomy, which again is a permanent removal of the nail, the next step will be to make a small incision here along the nail edge. This will expose the cells that the nail grows from, so we can permanently remove them, and this little one won't have to worry about coming back and having this done again. 2 skin hooks, please. Another skin hook. So here in this stage here, I'm just, again, cutting out the cells that the nail actually grows from. There are various ways to do these permanent procedures. Oftentimes we will use an acid called phenol to kill the cells. Other times there's lasers that can be removed. This is just simply the cells here that we just cut out. So those are other ways to do a permanent procedure. Here today we just decided to do it this way. So sometimes with the phenol and the acid procedures going and come out, you will see a return of the nail. The phenol won't actually be able to kill the nail cells. So by coming here to the OR and actually cutting the cells out, we can pretty much ensure that the nail edge will not grow back. Once this procedure has been performed, let's go ahead and take these out real quick. The patient will have a big bulky dressing. That dressing will need to remain in place for a few short hours. Typically we have them remove it before they go to bed at night or first thing the next morning. That dressing will then be changed daily. We have them apply a special wound gel called Revitaderm wound gel. And they just simply have to put the wound gel on there with a Band-Aid. Typically heals within about 10 to 14 days. We remove the stitch after 10 to 14 days and they are done. And they no longer have to put a dressing on it anymore. Put that. And then we just put one stitch across the incision line here. And that is all. If you have any other questions about ingrown toenails, how to care for them, or what to look for, you can visit my blog on Foot and Ankle Surgical Specialist. Thank you.